Hi, Dr. Tucker here. I want to talk a little bit about disc herniations and the different types of treatments that you'll have for them. There's typically two paths. You're going to have something medical and something more conservative. So, what is a disc herniation? Let's just get a little visual. Don't hold my artwork against me. But generally, there's cartilage in between the spine that can give and rupture. So, if you look at a spine, here's a healthy spine. There's L3, the bone, the disc, the bone, the disc. In between the bones, there's a hole where nerve roots pass through, the green. If this disc is cushioned and spaced well, there's plenty of breathing room for that nerve. That nerve will actually flow and go to many areas. So some of the nerves down in your lumbar spine, they can actually flow to, your bladder, your legs, your knees, your hips. So you want that current flowing 100%. So if you have a normal spine, normal cushion, well, there's plenty of room for that nerve supply. So what happens if the disc actually herniates? You'll see a loss of height. The herniated disc patient might not have the same spacing that the other patient does. So if that disc leaks into that hole, pinching that nerve, it's going to affect the way that nerve travels. So what does that mean? It means the nerve's going to have a percentage of impingement, and those tissues are not going to get ideal nerve supply. So something's pinching it. So medically, how do they manage this? Generally three ways, right? You're going to either get, and it doesn't matter if it's your primary doctor or your orthopedist, because initially you're going to get some cocktail of one of three things often. An anti-inflammatory, painkiller, or a muscle relaxant. If it's a disc herniation, it's often a lot of these pills might not really do much, but even if you do mask your pain, you got to be careful and not thinking you're feeling better and then actually injure the underlying condition worse off. Okay, so that's one thing, a chemical cocktail. The second thing is they might give you a shot. If they give you a shot, it's just getting in there doing the same thing, but it's invasive versus something oral. And then the last resort is something like surgery, where they'll try to go in and cut out some of the herniation. So obviously these procedures all have risks, and some of them are pretty significant, from the painkiller epidemic today to some adverse risks to surgery. So what's the alternative? You have conservative options. You can exercise, you can stretch. Specifically as it relates to disc herniations, quite often we hear people use inversion tables to try to hang. They're not bad in theory at all. Relatively safe most of the time, but you got to watch out, because I've had some patients who try to hang upside down, blood rushes to the head, and unless you have a brain MRI, you don't know 100% of what's going on up there, and that can induce vertigo. It can cause someone to just get lightheaded, and you don't necessarily want, a 75-year-old grandmother at home, unattended, hanging upside down, passing out. That could be a concern. If someone has a larger frame, sometimes the pull on their knees or their hips hanging upside down can hurt and be uncomfortable. So chiropractically, there's a couple things that are common. If a chiropractor has some sort of equipment that can actually stretch the spine, and instead of just a general stretch hanging upside down, they'll hold the specific L3 vertebrae here to isolate the distraction right at the herniated disc level. Over time, you can open up that space for the nerve and give it a little more breathing room. So the first step is a chiropractor with some disc decompression, disc distraction type tables can help that. It's a very specific thing. Now, as for homework, what can a patient do at home besides stretching? If they don't qualify for an inversion table, they can use something else that maybe stretches without flipping upside down. So maybe they can hang on a pull-up bar and stretch their spine. Or maybe in some cases, they'll qualify for some sort of decompression belt that you'll pump. It'll inflate these air cells and stretch your spine that way. So there are a few means of decompressing the spine without doing anything invasive. And usually if you don't do it invasively, you don't just mask it chemically, you're actually changing some of the physical structure, creating a little more breathing room around this foramen or hole where the nerves flow. The long-term results are much better. So hopefully it gives you a little more clarity on disc herniations. Take care.